Then you let that dry. And you can put the skin protector on now because this Stat Lock, has sticky on it as well. So it helps it stay, but I will tell you, sometimes you put that stuff on, and this thing is the hardest son of a gun to get off even a week later. You're like, were you glued on? And I'll tell you, if they did it at the 24-hour mark, to take it off at 24 hours, so hard. You feel like you're gonna rip the catheter out. Well, the catheter out, like you feel like you're gonna pull it out. You gotta be careful. So I can do the skin protectant. Oops. And then I'll do my Stat Lock. Now, if you kind of look at the Stat Lock, you'll see there's the little blue holes, and that's the holes on that will fit into it. Okay, and then you'll see these little things, and it snaps down. Now, you'll see so many people will go and stick this on the patient without snapping it down. And the first time you do this, really this is the only time, so hard to snap sometimes, and then you have to put the pressure on people when you do it, like on their chest, and it hurts. The trick to it is, snap it before you do the tape, take the tape off. Okay, is my hand sterile? It was sterile. So I can line up my holes. Maybe if that one will get in there. It's been on. And then I can snap it beforehand. Well, maybe not. It's going to be a pain in my booty. There we go. Then I can take that down and I can pull my adhesive. Then I can pull my adhesive, and then I can, for when you guys practice, don't do that because I only have a few of these, and then it gets even stickier. Okay, so then I'm good there. So let me grab my bio patch. The bio patch, you'll see a blue side, and then you'll see a white side. The white side's the medicated, and the blue side, and it'll say bio patch up, but just remember, blue skies. Skies up. Okay, and you'll put that right around the opening. If there's enough space on the line, a lot of times you can kind of get it under and loop it around. On this one, it's inserted too far that I can't get under it to loop around, but as long as I'm at that hole there.
That thing isn't sticky, though?
No. No, but if you have the adhesive thing on it, it helps it stick, and with the tape, it's not going to go anywhere. Okay? So then I have my Tegaderm. Now, in this case, yes, I'm going to have to use my clean hand, but it's going to be on the other side of this thing. There's really no way to avoid it. And okay. And they have this thing. Some nurses don't use this thing. They'll just write with permanent marker on that, and that's totally fine. You can do that. But I will say this tape actually does stay pretty well. Some of these other little stickers, like the Stat Lock gives you a sticker. I'm like, am I supposed to put that on there? Because I'm not. This thing will fall off in like 2 seconds. So no one puts those on there. But this one I actually do use. Put it to the side where you can still see your dressing. And then I would time, date, initial. Okay? Now, my dressing's complete. I can take this thing off. Whew. And as long as my gloves are still clean and not super tacky from the skin protectant, I can still use them. If they are, just get clean gloves, because now I'm going to change my caps, and I'm going to do it the same way that I did it when you did the blood change, or after you did the blood draw. You'll have this, and then you'll hook up your saline syringe, and flush. And you'll do it for all of them. Okay?
Every time you do a dressing change, you need to change.
We change the caps.
Mm-hmm.
All of them?
Because what you'll find is, especially if they become saline locked, except for getting an antibiotic like twice a day. So the line that gets the antibiotic, so say they use the middle line for that. So it'll get flushed and it'll get its antibiotic. And then they're drawing blood, so, and they're doing that from the distal line. But then they're like, oh, it's getting flushed because it's getting blood and this and that. And then everybody forgets to flush the poor little proximal. And then it gets clotted off. So the thing is just change all of them. Anytime